Good afternoon. Welcome to our show. I'm your host, Melissa Ridgen. It's been more than a decade since the last pandemic, that being H1N1, hit Canada. But COVID-19 has been much different in many ways. Certainly the panic, the fear and uncertainty being worse than anything that we saw back in 2009. But we're here today to hopefully calm you down and educate you about the virus. Today we are putting COVID-19 in focus. We're going to break it down. What is it? Is it just like the flu? No, it's not. How to be safer? What do you need to do to self-isolate? If you're in a community with a boil water advisory, can you still clean? Well, yeah, you can. We'll fill you in. We are going to share some of the human good that's coming from the situation that has had a far-reaching effect, whether you're in remote First Nations or in Inuit communities, or if you're in large urban centers. We will feature some helpers to hopefully inspire you as all of this madness goes on around us. It's a call-in show, so of course if there's anything that you want to share or if you have questions, we'll try to get you answers. Later in the show, you can feel free to call with some of the good that you've seen in your community, people sharing medicines or food and supplies. Our phone lines are open. You can give us a call toll-free at 1-877-647-2786. You can also tweet us at APTN InFocus. I do want to say, though, in keeping with the social distancing that's been recommended, we don't have anybody in our studio here today. It's just me here by myself. So if you're phoning to look for some medical information or anything, I am not your girl. I'm a journalist. I can tell you what I've learned from researching this, but I certainly, we don't have a doctor who's here. It is just, as you can see now, just me. Before we get started, let's take a look at the latest numbers across the country. This information comes from the Canada Public Health Services. This is as of 9:30 Eastern Time this morning. So let's take a look at the map and see what our numbers are. Canadian Press is reporting that the total global cases of COVID-19 is 173,344. That's worldwide, with 7,019 deaths. We are looking now. Let's go to Canada. Another thing that we want to, well, here, hang on a second. So we've got 186 in British Columbia, right? Currently, this is as of this morning. 189 in Ontario, still none up in the territories. 97 in Alberta. When you're seeing the two in the red there, that is confirmed. The yellows are presumptive. That means they haven't been confirmed yet, but it's looking like they might be. Atlantic Canada, still relatively few number. One confirmed in PEI in Nova Scotia. Okay, so let's, before we get going, let's clear up another thing. There seems to be some confusion out there about the name of the virus. At first, we were calling it the coronavirus, and then suddenly it became COVID-19. So in a nutshell, COVID-19 is a type of coronavirus. There are many types of coronaviruses, and after studying this strain from Wuhan, China, scientists have labeled this particular coronavirus COVID-19. Then there was some confusion when a photo circulated online of a cleaning supply label that says that it's effective in killing human coronavirus. Again, there's lots of coronaviruses out there. They've been around for a long time. We just didn't hear about them because they weren't in the news. This one, COVID-19, is new. Soap and other disinfectants have been shown to kill the virus. Soap and water kills a lot of viruses and bacteria. This being no different, so be clean. That's why everybody's saying really, wash your hands, use soap and water. Very important for anybody who is in a community that has a boil water advisory. According to the federal government's website, there are 61 long-term boil water advisories currently right now. There are dozens more short-term boil water advisories across every province. These advisories do not mean that you are at risk of catching COVID-19. You can clean with this water. It means you can boil the water. You don't even have to. You can actually use it right out of the tap. You just can't ingest it. So you can't drink this water without boiling it, right? Right from the tap. Use your cleaning supplies, your soap, your disinfectant. It will kill this virus. So don't panic. That was from Dr. Shannon McDonald of the British Columbia First Nations Health Authority. She told APTN News earlier this week that water, even if you need to boil it, you can use it straight out of the tap with cleaning supplies to clean with it, to wash your hands with it. What about the idea that probably a lot of us have seen on social media, this is just like the flu, don't worry about it? Well, we found this handy explainer from the Alberta government's website, which in researching for this show, we found Alberta has one of the most user-friendly of all the government websites with COVID-19 info. It says, in some ways, COVID-19 is similar to influenza, also known as the flu. Both COVID-19 and the flu cause respiratory effects on people who get it. Both are spread in the same way via small droplets from the nose and mouth. That's why it's, of course, important to clean or to cover your nose and mouth when you're sneezing, to keep your hands clean. Neither one is spread through the air over long distances and times, which we're now seeing a lot of people talking about that if if you're outside, you can get it. This isn't the case. It's not like the measles. It's not like where it can travel from long distances of space through the air. However, there's some key differences between COVID-19 and the flu. COVID-19 does not appear to transmit as efficiently as influenza. Only those with symptoms seem to be mainly spreading this disease. It means that when people with symptoms are isolated, controlling the spread is possible. That's why you're hearing things about social distancing, staying home. If you've got symptoms, stay home. If you're concerned that maybe you have been exposed, stay home. We currently have no specific vaccine or treatment for COVID-19. COVID-19 causes severe disease in a higher percentage of cases than seasonal influenza. So estimates of the mortality of COVID-19 depends on many things, but on average, they range from about 1 to 2 deaths per 100 people infected. By comparison, seasonal influenza is deadly in about 1 in every 1,000 people who are infected. So when you're hearing, oh, it's just like the flu, there's some similarities in terms of it's a respiratory illness. It's not. I still don't know why people are panic buying the toilet paper. It doesn't have anything to do with your intestines, but we'll get to panic buying toilet paper later in the show. I had the chance to chat with Dr. Barry LaValle recently. He's an Indigenous physician here in Manitoba who specializes in Indigenous health and has been working with Indigenous patients his entire career. He's also a calming source, I find, and I wanted to share with you his advice and expertise on getting through this pandemic. Thank you for joining us, Dr. LaValle. So the federal government said that COVID-19 could infect between 30 and 70% of Canadians. Will Indigenous people be at a lower risk because of the remoteness of our communities, or at a higher risk because of crowded housing, poor plumbing, underlying health issues?
We really can't say at this moment, and even the models that look at how fast the virus will travel and how many people will be exposed, I believe, vary. Some of the concerns that we do have for First Nations communities, Métis communities, and perhaps some Inuit communities is really looking at the living conditions. Mm-hmm. So whether people have access to good food, quantity, quality, whether there's not a lot of overcrowding or overcrowding in their homes. And really you have to think as well, for First Nations and Métis particularly, there's a lot of diabetes. There's different chronic diseases. And so those things can actually, when you think about it, make a person perhaps more vulnerable, or perhaps they can get sicker if the virus comes. Mm-hmm. So that certainly is on the minds of a lot of people at this point, including First Nations and Métis leadership.
Yeah. Well, what advice can you share with our viewers about how to protect yourself? And for, if we talk about going to self-isolation, if you think that you may have been exposed, you're not feeling well, and you don't know what it is, how do you even go into self-isolation if you're living in a home with, say, 10 people? Sure,
that's a great question. I think people in the communities have to think about this not as an individual going into isolation, but really take it to the family. Mm-hmm. So if you have a couple of people who are sick, a child and perhaps a mom or dad or whoever's at home, the family itself probably has to go into isolation. So unlike what some of the messaging is about a personal self-isolation, sometimes it's not practical. But there are many things that individuals and community people could do to slow the spread of the virus.
What are those?
And that's really the highlight of what we need to address. So things like washing your hands and practicing washing your hands as is directed by your local health authorities, and not taking it you have to take it very seriously. If we can slow the virus coming into the communities, we actually can ensure that the local health providers can serve those who need to be seen. Also that our chief and councils and our Métis councils and our governing structures in the communities can attend to our needs. If there are needs where perhaps we need food, we need to get help taking care of our kids, any number of things of that nature. So washing hands for 20 seconds multiple times through the day, but in specific times like if you've taken care of a sick person, before you get food ready, when you go to the toilet, if you actually visited somebody who was sick, protecting yourself in that way, that's one of the main things. So that's actually a very powerful thing to start practicing immediately, actually. There are a number of other things you could do as well. So I want to remind people that getting your medications, if you have diabetes or if you have any other kind of illness, if you've had a stroke or heart disease, if you've had cancer, really practice taking care of yourself and making your immune system or your body able to handle the virus should it come your way. So get your medications, take care of yourself, and this really, for all of our community people, this is an opportunity to really consider to stop smoking. By making the lungs as healthy as possible, it can diminish or reduce the chances that we could get very ill with the virus. Now, on top of that, let's remember that some of the information we have from previous activities in other parts of the world, most people will not get sick. They'll certainly have some symptoms, a runny nose, a bit of a cough, perhaps a bit of a fever. They're going to do well, okay? You have to think about, in your communities, whether you're in Edmonton, Toronto, Winnipeg, or the far north, watch out for your grandma and grandpa. Watch out for your old uncle and auntie, or perhaps the people who live alone and don't have a lot of support. Someone in the community, in the family, has to take the obligation to go bang on the door and find out if your auntie or uncle is doing well. We know that with this virus, particularly those who are older and those who have those chronic diseases I mentioned, like diabetes, etc., they're the ones we worry about. Okay, so watch out for them.
Yeah. Well, thank you. This is very valuable advice. I know we all appreciate it, and thanks for calming us down a little bit.
Okay, you're welcome.
That was our friend, Dr. Barry LaValle, who was in our studio last week, who talked to us. But that was back when we were allowed to have people in our studio, which we are not anymore, in keeping with social distancing practices. So joining me now is Tanya Cameron. She's not in studio, she's joining us from Kenora, Ontario. She is the Northwest Regional Coordinator at Aboriginal Sports and Wellness Council of Ontario. She's been in pandemic planning mode for Northwestern Ontario since this all began several weeks ago. Tanya, you're in Kenora, as I said, social distancing as we are supposed to be doing when possible. Walk us through what went through your mind a few months ago when we started seeing the jump from cases from China to elsewhere.
Yeah, so one of the things as watching the news, like everyone else, was how fast it's spreading. And when it was declared a pandemic, a global pandemic, I picked up my phone and I messaged my chief, because back in 2009, through the whole height of the H1N1 and the pandemic planning there, we worked together on that. And I said simply, please tell me our pandemic plan is up to date.
And was it?
It wasn't.
No.
It wasn't. So the last 5 days, I've been reviewing it, uploading the new information that we have, putting as much information on my own social media. And then I started getting requests to go other communities to help. And it's even this morning, I got a call from another First Nation who feels that they're not prepared. So it's just sharing information as much as I can through federal website, the information that we see from Canada.
So has there been a lot of panic from First Nations, or is it just a kind of safety first, let's take our precautions, or are you sensing panic now?
I think there's a sense of urgency. I know over the last couple of days, I was in 2 different communities and with community members that are saying, where are we? What do we have? What resources do we have? And there are already work done by leadership and some staff that in terms of preparation. So there is an urgency. I wouldn't say panic mode just yet.
Okay.
But there is a sense of panic because in our towns and cities nearby our First Nations, there has been a lot of panic buying.
Yeah.
So our communities are concerned about our own access to supplies and food and what does that look like, especially when a lot of our families are waiting for their child tax and aren't able to shop. So it's a huge concern.
Yeah. This is different than you said that you'd done work back in 2009 on H1N1. Can you explain to us why is it different this time? This has a total different feel than H1N1 did back in 2009.
Yeah, I think it's the effect that it's had on people right around the globe and how fast it's spreading. And now we're at a discussion point where maybe it will come here, but now today it's like it is coming. What can we do to prepare for that day that it reaches our communities? So that's the urgency. H1N1 was like, it may come here. Let's try to limit how it will come into our communities. But now even our elders are saying it's going to come. Let's plan like it's going to be here and let's get things moving as quick as possible.
You talk about pandemic plans. We hear this, people talking all over the place about their pandemic plan. What is in a pandemic plan?
So a lot of it's going to be the community responsibilities. There's several levels of responsibility. So it's community level. So it's chief and council, all the staff to our own community members. And then it's going to be what are the provincial responsibilities to our community? What are the federal responsibilities to our community? And these are ongoing daily discussions. Some communities are actually taking a lot of their own planning into their own hands because we still don't know what exactly my own community is going to be receiving in terms of supplies or equipment. We've got a very, very sparse medical supply room.
Yeah.
Yeah.
Dr. LaValle had said earlier about the, kind of tighten your circle, right? You can self-isolate your family. Are you recommending to communities to consider isolate the community? Nobody comes in, nobody comes out. I mean, if you don't have anybody who's brought it in, is isolating that community your best defense? Is that something that you guys are having conversations about?
Most of the communities around the Kenora area here in the Treaty 3 territory have already started establishing checkpoints. So while they're not in quarantine, or they are limiting who has access to their community, if they're local members, they're encouraging any local community members to have limit their times into towns to get their supplies. These are real discussions. The less you can go into town for supplies or shopping, please limit it.
Smart.
Or even have one shopper. Don't go as a family to go do that. Just try to limit your possible transmission or receiving of this virus.
That's great advice too. There's lots of talk about, there's lots of our communities have too many people living in too few houses. Is there a special risk with regards to that?
Yeah, that's the key discussion, is the overcrowding of homes. Most homes have one washroom, so it's about, do we have the disinfectants in our community? I've been advising people that are going out to shop, just get the bleach. Don't worry about trying to find the Lysol or the wipes. The bleach with mixing it 1 part bleach, 9 parts water. Okay. That's the most effective disinfectant we have probably available to our communities.
So the bleach, sending one person to get supplies, not going as a group. Is there any other advice that you would give? There's lots of people looking outside of Treaty 3 territory, maybe have the exact same questions. What other advice would you give to them?
We've been asking some of the ones with chronic illnesses to start getting their their medicines, maybe the 30-day supply. I understand FINIB has released a guideline to pharmacies in the region saying that they can allow a 30-day supply. Some of that was like by 2 weeks, so that's open for our chronically ill.
Smart. We have a caller that we will go to now. Ben, are you there?
Yes, I am.
Hey, Ben, how are you?
I'm good, Melissa. How are you?
I'm great. Did you have a question or a comment?
I have a comment. First of all, I'd like to say I really thoroughly enjoy your program. Also on this coronavirus, Melissa, two weeks ago I took my daughter, she's 9 years old, I'm a single dad. I took her out of school because of the coronavirus outbreak.
Where's your community?
Kikino, Alberta.
Okay.
I'm from Métis settlement. I took the measures myself. I didn't wait for authorities to say we're going to close the school. I didn't wait. Government, all these big corporations were closing doors, and I took the onus on myself to do that for my daughter, to protect her, and I also got her to wear a breathing mask and start sanitizing, washing her hands. I emphasized that with her, but also I talked to my other children, and I told them, like, we're from the north, we're in the country, not all Métis, First Nations, Inuit have that luxury of living in the country as we do.
Yeah.
Well, I talked to the children about being self-sufficient, like we're going to start gardening properly, growing our own produce, and raising some chickens and pigs to be self-sufficient, so we won't have to shop as much and rely on.
I love that line of thinking. It's funny because I was thinking the exact same thing when we're watching people panic buying toilet paper and the ridiculousness of that. I thought, this is when more of us should be thinking about trying to grow our own things, buying the seeds, growing your own produce when possible. So I like that that's the response that you had, not to run out and bulk buy toilet paper so nobody else gets it when their child tax comes in.
That's right. And also, Melissa, just to put it out there for some of the viewers, I've also discussed with my children that I want to talk to the leadership to see if we can get a community gardening thing going here with horticulture, and helping our elders, like to provide for some of our elders with fish and wild meat and stuff. Make sure we emphasize protection for our elders too. So that's where we're going with this. Like, we're not trying to panic and scare people, to push them into this lifestyle. But I think it's something to viewers out there. If you're living out in the boonies like I do, look at maybe,
get thinking about it. Thanks for that, Ben. That's awesome advice. Thanks. Tanya, we're running out of time a little bit, but I want to leave this with you. Aside from preparedness and trying to, tighten the circle a little bit, what about the best way to deal with the mental health surrounding this? Yeah.
So what I've been doing every day is actually going out on the land. And I find that the most therapeutic measures for me to unwind, because some of our discussions with our elders, our young parents, are quite emotional because we are talking about worst case scenario. And I find going in the walk in the bush is therapeutic. We did a medicine walk the other day with my sister-in-law, and we picked chaga, we picked Labrador for tea, and we went cedar picking. So it helps me unwind after such a serious discussions. I think that's very therapeutic and helpful.
That is the best advice to you. This is a great segment. I love Dr. Lavalley. We have Ben the caller. We have Tanya. Thank you guys. I think we're blessed that we have people like you sharing this and kind of calming us down. Tanya, thank you so much. Good luck in the weeks ahead. I'm sure you will continue to be busy.
Yes, thank you.
Okay. We need to take a break, but when we come back, you can either be the jerk who panic buys toilet paper and hoards supplies, or you can be the helper. We're going to take a look at the many people who are being good Samaritans in the face of COVID-19, so stay with us.
Join our conversation now. Call in toll-free at 1-877-647-2786. Like us on Facebook on our APTN News page. Follow or tweet us at APTN InFocus. And send your thoughts to infocus@aptn.ca.
Welcome back. Let's go to social media now with our social media editor, Jesse Andrushko, to hear what some of you guys are saying about today's topic. We also have another caller who we'll be getting to shortly, so to the caller, just hang tight here. Go, Jesse.
Thanks, Melissa. We posted a poll online asking, are you prepared for a 2-week self-quarantine if required? With over 1,000 respondents, 64% said yes, 36% responded no. We also heard a lot of feedback from Marvin. Usually enough meat for about 3 months kept in freezer. Always have fixings for Bannock. Patrick responded, I'm healthy, active person, not quarantining over a flu virus. Just gonna continue to watch people overreact until this nonsense is over. Seeing Patrick's comment, please keep in mind self-isolation is not only for your own protection, but really it's to prevent the spread of COVID-19 to people who are at risk. Lastly, from Priscilla, I'm a senior. I bought all I needed for 2 weeks. I did not overstock. Creator has a way of looking after seniors. Self-monitor. For all of our coverage on COVID-19, visit aptnnews.ca/COVID-19. If you'd like to add your opinion to our topic of conversation, here's how. Join our conversation now. Call in toll-free at 1-877-647-2786. Like us on Facebook on our APTN News page. Follow or tweet us at APTN InFocus. And send your thoughts to infocus@aptn.ca.
I love that comment from Marvin. There is no need to panic if you've got Bannock, right, Marvin? Before the break, we talked about how to stay safe at a time that we haven't experienced before with this COVID-19 preparedness. We talked about some of the myths versus some of the facts. Now we're going to talk about the human good that we're seeing at a time where we're being bombarded by media and social media about people panic buying things like toilet paper and other supplies, people just being ridiculous humans. But there are other people. We've got people who are doing the exact opposite. And when the going gets tough, they get generous. They look out for the people who are most vulnerable among them. They are our warriors. When COVID-19 hit Vancouver earlier this month, it occurred to some people, what if this hits the homeless population? Here's a look at a story that Tina House did.
With health officials saying that washing your hands with clean water and soap is the best way to prevent the spread of COVID-19, thousands of homeless people across the country do not have that luxury. And one look around this tent city in Oppenheimer Park, many people would say that this is an example of extreme poverty. However, according to Chrissy Brett, despite their situation, she says, believe it or not, they are actually considered the lucky ones, because they have access to a sink with running water and soap to wash their hands.
Here we do have access to a bathroom. We continue to work with the city to try and figure out ways that we can continue to ensure that these bathrooms are open. The men's is currently closed for repair, which will take a few days.
Jeff Redding is the chair of the First Nations Health Authority. He says that the COVID-19 pandemic is rapidly changing, and he's also concerned about the homeless population.
They need to be particularly careful. It's up to urban entities, to be able to go forward and educate and provide services to people who are in these vulnerable circumstances.
We asked the City of Vancouver about what's being done to help the homeless, and they sent this statement. Right now, Vancouver Coastal Health has said that the risk remains low, and the City of Vancouver will adjust our response based upon the organization's recommendations. But those sentiments are not being shared by Olga Simpson. Since she heard about the coronavirus, she's been deeply concerned.
Do you think enough is being done right now to prevent the spread here in the downtown side?
No, we're not even told nothing. We should have little writings about it, how to prevent. Because none of these people have no TVs, like you said. They don't know what's going on.
Tina House, APTN National News, Vancouver.
We'll go now to, we have a caller, Mario calling. Are you there, Mario?
Yes. Yes.
Hey. How are you, Mario? Do you have a question or comment?
Fine. I've been hearing about this disease since January, yes.
And is it something that fills you with panic or worry, or what do you think of it?
No, I seem to believe there's too much exaggeration on this. If you know what I mean?
Yeah, do you mean people's reaction to
means,
it?
Naturally in life, on how people are confused with confusion. A common understanding about this disease. This is a serious disease, and that's why naturally in life there's been other disease. A few years ago there was a disease there. I don't know.
H1N1.
Yeah,
we were just talking about that one too.
Yeah, anthrax, yes. And people went through it at that time. Remember anthrax? People lived and went through it. I do not believe at that time when there was anthrax, at that time people had all these solicited issues that were insults towards things that are clean and washroom paper and everything. This time this is a new disease that people have to learn with education and science. And because they have to understand about it, is something on somehow it will be less confusing to too many people. This is a confusing issue. This is an issue that's from the lungs. It has nothing to do with any other parts of the body that they can seek understanding.
Yeah, but they're still buying toilet paper in hordes.
Last week I was listening to Global News, and Southern Ontario, they were missing toilet paper.
Yeah.
For the population of Southern Ontario.
Yeah.
It's all across.
We're in insane times for sure, Mario. Thank you for calling.
Yeah,
we got two other callers here.
It's sad that there is diseases, yes, but every disease needs a vaccine. There's too many of them.
Yeah, agreed. Well, and I have no doubt we'll get to that point in time where there will be a vaccine on this too.
That's why sometimes it's confusing.
Yeah.
Okay, thank you very much.
Thanks, Mario. Have a great day.
Bye-bye. Thank you.
Okay, joining us now. Oh, actually, we're going to do this first. So while social media has been filled with the insanity of people hoarding goods, like we were just talking about, it's also been filled with a few people going above and beyond to help others. So we kind of collected a few of our favorites here at APTN InFocus that I want to share with you. Let's check out the Soto First Nation. They put together care bags for households with cleaning products that they delivered to everybody, so people didn't have to worry about venturing out to stores outside of the community to get supplies. I think we have a photo here. Yeah, so this is from Soto First Nation. You can see all of the different sanitation supplies, and they bagged them all up. Thanks for this photo, Kenny Moccasin. That's at the Soto First Nation. And then Calvin Clark here in Winnipeg, he grabbed his medicine and started making tea, cedar and bare root. He posted this photo on Facebook and saying that he was going to be delivering tea to elders in his building, and offered for others who wanted to come to his place and pick it up. Just said, bring your own container. I'll leave it outside the door. You can help yourself. This is, again, still here in Winnipeg. Feast Bistro was concerned about people who couldn't get out and get food while everybody started the hoarding that we saw. Well, one customer got the ball rolling with a $250 donation to Feast Bistro to make food, to cook and deliver meals to people in need. Love that one too. And then in Puckatawagan, the chief was spotted going door to door talking with everybody about medicines, how to use them, who to get them from, the importance of drinking your medicine and purifying the air that you breathe. So that was up in Puckatawagan, and also that's here in Manitoba. Thanks for that in this picture from Bear 67. So there is a lot of good that's happening amid the madness. So we are going to talk to two other helpers now. Jolie Saskamoose is in Regina. She's part of a growing movement of people who have begun offering support and supplies to elderly and vulnerable people who shouldn't leave their home at a time like this in order to protect themselves from the virus. So Jolene, she's part of a group called the Matriarchs on Duty. It's a Facebook group there. And we're joined by Rachel Ann Snow from Morley, Alberta. She and others quickly mobilized last week when they noticed the madness of panic buying and wanted to help the vulnerable people in their community who couldn't get to the store, or many others who just couldn't afford to get supplies at that point in time. Like we were saying, people on low incomes often get paid at a certain time. If the craziness of people stockpiling supplies happens at a time where they haven't been paid, what are they supposed to do? So thank you, Rachel and Jolene, for joining us today. I haven't seen Rachel up there. Or Rachel's on the phone?
Yes.
Rachel, thanks for joining us. I'll start with you. As you watched this unfold, like the rest of us a few weeks ago, I think the first thing for most of us was the toilet paper hoarding, that we're like, what is going on? Explain to me what was going through your mind as you're watching this over the weeks, and what made you realize that this was something you needed to help the vulnerable in your community.
First of all, I just want to say Amawashte to everybody out there. Good day. And I think one of the things we noticed was that one of the things we keep track of in our Indigenous communities is our elders. Our elderly people are our universities. They are our knowledge keepers. So what we were worried about was the elders, and we were lucky enough to get a donation from Ralph Connor United Church in Canmore. My brothers and sisters and my late father all worked at the United Church. So they were able to, the parishioners got together, sent some supplies to the reserve, and then we packaged them and distributed them, similar to the other stories that you're hearing, because it's necessary to always remember our elders in our community, because they are a vital part of who we are as Indigenous people.
Yeah. Or did you know when you were delivering these, is there a fear? Was there a panic among them, or is there some cooler heads out there?
I think there were cooler heads out there. I think they were just very thankful. They said, we're glad for the visit. And my son had also shot a moose, so we were able to cut up some moose meat and take that around. So that was like a little side perk that we could give to our people, so that they would also have at least enough meat for a meal, because it's important to remember those Indigenous traditions we have to give and to help and to be mindful of our elderly people.
Love it. Jolene, you, of course, would have been watching this all unfold like the rest of us and seeing people getting a little bit crazy. What goes through your mind, and how did you and your group decide, here's what we got to do?
I think it was a bit more organic than that. I saw a couple of my elders recently who had been released from the hospital, and they're still pretty weak. So I was concerned as we were getting closer to this virus hitting what will happen to them. I'm a member of Matriarchs on Duty, and I just put a call out and said, hey, I have some ideas about things that we might want to do to keep track of them, and we just started keeping lists, and that's really as simple as it's been. And now we have people on the ground gathering supplies, delivering them, gathering stuff. We'll start cooking soon. We're going to prepare soup to keep in people's freezers. So we're just trying to look out on a small scale, but it's growing. That's great.
Well, I was going to say, this sounds like a pretty massive undertaking. How many people? These things can balloon pretty quickly. You go set out to help when you see a need, and then suddenly you see there's a way bigger need. How do you not get kind of bowled over by it?
It is overwhelming. It's overwhelming, but I think that those of us who are healthy know that we're giving all the energy we can, and that we might not be healthy soon. So I think we need to give the energy while we have it. And I think that people are in preparatory stages, and we're trying to learn as much as we can. The cities are going to get hit very differently than the communities, and so I think we need to be preventative and cautious. And Indigenous people, we always take care of ourselves anyway. We know how to barter. I don't think we're in fear as much as the non-Indigenous people, and I think we're trying to share our knowledge with them and show them that we've been through crises before, and we know how to do it.
I'm curious, Rachel, do you see, when you see something like this going on, do you think that it brings out the worst in people, or do you think it brings out the best in people?
Well, I think Jolene said it correctly. Like, as Indigenous people, we're collective. We're community-minded. So in our community, there are going to be people who are concerned for the people and for the land and for the waters. And that's our role as Indigenous people. And since we're spread out, we're semi-isolated as it is. So we're going to do as much as we can to assist. And I think it's also a matter of keeping our spirituality. You talked about the teas and the other things that are being used, the medicines that we have that we are being used. I think it's really reclamation, decolonization, and remembering who we are, and that those skills will always serve us into the future, and that we should be able to share those with the non-Indigenous public so that they can learn, you know, what it is to help one another and be part of a collective or be part of a people.
I love that. Jolene, what's your plan? I mean, this could go, we could be in this position for several months. Do you guys have the wherewithal to keep going on this for months to come?
I really don't know that we have a choice not to, really. So I think that it's just what everyone else is doing, is going with the flow and being optimistic and positive and putting our best foot forward every single day. And there might be a day that I have the feeling can't do it, and someone else will pick that up. I just think that this is an opportunity for us to become a community again. I think it's what Mother Earth kind of enforcing on us. And I think Indigenous people have had these teachings, and we've known this is coming, the cleansing of the earth. We've known this for our whole lives. This is not shocking. It's shocking in our bodies because we're experiencing it.
Yeah.
I mean, I'm in anxiety, I'm stressed, I'm nervous, but the reality is we've known this is coming. We are prepared, and we're ready to hit the ground.
Well, I want to say to you, Jolene, and to Rachel, that I'm thankful that we have women like you, good Samaritans like you, who see the big picture of this and choose to go and help others instead of being part of the problem. Because anybody who's got a TV and has been watching the news or online has seen that there's no shortage of people who are being part of the problem. So thank you both for taking the time to share that with us. Hopefully it inspires other people at home to look around and see what needs they can meet in their own community. So thank you guys very much. We've got to take another quick break, but when we come back, we're going to talk to a woman from Quebec who was on a vacation with her friends and came back to find that their community was closing the door to visitors, and she'll share that journey with us, so stay with us. Welcome back. Let's check in again with our social media editor, Jesse Andrushko, to hear some more of the comments from you, our beloved viewers.
Thanks, Melissa. In another poll we posted online, we asked, do you think Canada and your community is prepared to deal with the viral outbreak, which is COVID-19? 24% of you responded yes, 76% responded no. Here's some of the feedback you gave us. Stuart said, do what you can to help those who may need it. There are many elderly people that may need assistance soon. Watch out for people trying to take advantage of people during this time. Jay commented, the rich are prepared, but the poor working class are the ones who will suffer. This crisis is just amplifying the inequalities in our society. And lastly, from Karen, a social epidemic requires knowledge and social action on the part of everyone to contain it. The sooner we work together, the sooner it will be contained. For all of our coverage again on COVID-19, visit aptnnews.ca/COVID-19. If you'd like to add your opinion to our topic of conversation, here's how. Join our conversation now. Call in toll-free at 1-877-647-2786. Like us on Facebook on our APTN News page. Follow or tweet us at APTN InFocus. And send your thoughts to infocus@aptn.ca.
So there's a lot of coverage about what is happening in the heavily populated provinces like Ontario and in British Columbia and Quebec. But what about the north and the east? Let's take a look at the Atlantic region, where Prince Edward Island is reporting 1 confirmed case of COVID-19. New Brunswick is reporting 2 confirmed cases and 6 probable cases. And Nova Scotia has confirmed 1 confirmed and 6 presumptive. Newfoundland and Labrador has 3 presumptive cases. So Tanis Sillyboy, he's a nurse in Eskastoni. He made several posters, which we saw, but we'll see them again, to protect community members in his community. So he made these posters. It shows the risk level of coronavirus, and it lets visitors know that people are susceptible or in self-isolation, and he's been sharing those posters with others in the communities on Cape Breton Island in hopes that more communities will do the same to reduce the risk of spreading that virus. We aren't going to see them again. So there's still no confirmed cases of COVID-19 in Nunavut, and the territorial government has started daily briefings, though, to keep residents informed. One of the questions that they've been receiving from residents is, why aren't people getting tests for the virus before symptoms arrive? Well, according to Nunavut's chief public health officer, that would be bad science and would create even more risk for the territory that remains currently untouched.
If you are exposed on Thursday and swabbed on the Saturday, the test will probably come back negative, and 4 days later, when symptoms appear, people tend to think that since they were tested, they don't have to worry about COVID, and will then spend several days out of isolation spreading the infection.
So we are joined now by Marlene Joly. She's from the Namaska Cree Nation in Quebec. Her and several friends were on a beautiful vacation and are now midway through a nightmare at the end of their vacation. Marlene, you guys were in the Dominican Republic. People from your community had gone. And then when you returned last week, you got a phone call on your way home. What did you find out?
Well, we arrived on March 12th. We got in around 9 o'clock in the evening, and we got a call right away as soon as we landed in Montreal. And we were told that not to come home where we're from in our community. So
what's your reaction?
Pardon?
What was your reaction? We're looking here at a group photo from your guys' vacation. This is, I'm not sure if you can see it or not, but there's the four of you, and I don't know which one you are in this photo. Are you in burgundy or black or blue?
Black, I think.
Okay. So explain to us again. So you guys are on your way back to Namaska, and you get this phone call from somebody with the health office in your community saying, "Hey guys, sorry, you guys can't come back." What was the reaction to that, to everybody in your car?
We kind of like panic a bit, but we still left Montreal, so we had to drove like 6 hours to get to Val-d'Or, and we said we're going to stay there for overnight, and then we'll decide what to do. Mm-hmm. But they told us to call this 1-800 number to get tested, I guess, if we have the COVID-19.
Yeah. Did you guys get tested?
We called them and they said we don't really need to go to the hospital for this because we didn't have any symptoms.
Mm-hmm. But your band had still said, "Hey, we want you guys to stay away and isolate for 2 weeks." The band had offered to pay to put you guys up in Val-d'Or, but still you guys have been away from your kids and were, of course, homesick and wanting to get home. What was the reaction? Was that, what a way to end a trip, or what was the conversation that you ladies were having?
We asked them if we can just isolate them ourselves in one home where our community is. Mm-hmm. That was our options because we were too anxious to get home.
Yeah.
We felt more safer to be in our community.
That makes perfect sense. So you guys are you're back home in Namaska, all together in one house, self-isolating. Probably not as much fun as the Dominican when you were all together. How are you? What are you guys doing to get through the boredom or the I would assume that you get that cabin fever going. What are you guys doing to keep sane through all of it?
Well, we entertain ourselves. We're planning to have a karaoke night, and we had the fondue night the other night, and we do a little stuff.
I love it. This is a good crew that you're with. How are you? You guys are all still feeling totally fine?
We're okay. We're managing pretty well, taking one day at a time.
Not sick though?
No, we're not sick.
And I understand that your son left on a school trip and you had to say goodbye by phone. How is that? I think we have a photo of him too.
Yeah.
Getting ready to go.
Yeah.
Oh, we don't.
It was sad for me because I wasn't there for him. Luckily, my parents were there for him to prepare himself to go on the winter journey. Oh. And I'm very happy that my parents were there.
Do you think, when do you get life back to normal? How many more days are you guys in lockdown?
We're on the 7th day, so we're halfway there.
Yeah. Do you think your band did the right thing by saying you guys were gone, you got to isolate?
I think it's a good good thing that we isolate ourselves for the safety for the community.
Yeah.
Yeah.
Awesome. Well, I wish you guys I hope that the next 7 days fly by for you ladies. It sounds like you're imaginative enough that you'll find other things to do to keep busy. Have another fondue night. And thanks for sharing that with us, Marlene. Take care.
All right. Thank you.
Okay. We are all out of time. APTN News is, of course, on top of the COVID-19 pandemic to keep you up to speed as this very fluid situation keeps changing. So be sure to keep an eye on our website, aptnnews.ca, or get the APTN News app on your smartphone. This episode of APTN InFocus will be available for download as a podcast on our website at aptnnews.ca/podcast if you want to share that with friends. I'm Melissa Ridgen. Have a great afternoon, and we'll see you tonight for the news.